At UCSF Fresno, the Hepatology Fellowship Program introduces fellows to inpatient and outpatient management of patients with a wide range of acute and chronic liver diseases. Marina Reutemann, Liver Program Director at UCSF Fresno, teaches hepatology to gastroenterology fellows, internal medicine residents, medical students, and advanced practice providers. One of her academic interests includes viral hepatitis.
I love to teach. This is why I'm here at UCSF Fresno. I give lectures on viral hepatitis, hepatitis B and C, certainly to the gastroenterology and hepatology fellows. I also teach internal medicine residents, family medicine residents, obstetric gynecology residents. So I try to cast as wide of a net as possible with educating the providers who will potentially be in the situation of being able to diagnose the patient.
Prevalence of liver disease is increasing in the U.S. population in general and in young people in particular due to an increase in obesity, metabolic risk factors, alcohol misuse disorder, and an opioid epidemic. Therefore, it is critical for all physicians to be familiar and comfortable diagnosing and taking care of patients with liver disease. Dr. Jennifer Yoon is a second-year gastroenterology fellow who previously completed the Hepatology Fellowship. The program exceeded her expectations by providing and enriching the learning environment, exposure to clinical skills, and significant involvement in patient care.
Overall, I think the experience as a hepatology fellow is pretty impactful and pretty rewarding. You work with a lot of patients from the Central Valley, both inpatient and outpatient. And there's just a lot of learning that happens. So kind of your development as a clinician and kind of professional development, I felt like I really progressed quite far.
Fellows gain a broad knowledge of the physiology of the liver and a thorough knowledge of the management of patients with liver diseases.
Our goal is to diagnose hepatitis C early. And the reason we want to diagnose it early because we now have a true cure for hepatitis C. What that means is you will get diagnosed with hepatitis C by a simple blood test. And then you will be put on medication anywhere from 8 to 12 weeks, a very well-tolerated medication, and amazingly and remarkably, you will be cured from hepatitis C.
Dr. Yoon is grateful to be learning from attendings, including Dr. Reutemann, who she says is incredibly involved in the Hepatology Fellows education.
There's a lot of pathology here, so the opportunity to learn is, there's just so much of it here. And I'm definitely grateful that I went through the hepatology program. As a GI fellow, I think I'm definitely using all of the information and all of the skills that I acquired as a hepatology fellow into what I'm doing now.
The Hepatology Fellowship was established in 2022 and is a one-year program within the Department of Internal Medicine that accepts one fellow per year. I'm Lucero Benitez for UCSF Fresno Up Close.